This man is 65 years old and has been offered screening to check for an abdominal aortic aneurysm. If he accepts, we'll paint him in warm colours, and if he declines, we'll paint him in cool colours. We'll follow these men over the next 10 years. But to understand the possible outcomes and the chances of each, we need many more. More than 100, more than 1,000. In fact, we need to compare 10,000 men who accept screening with 10,000 men who decline. Let's fast forward 10 years, recording the number of men who unfortunately die because of an abdominal aortic aneurysm. We see that among the 10,000 men who opted to be screened, there are 33 deaths. But in the group that declined screening, there are a total of 85 deaths. That's 52 more than in the screened group. To get a better picture, we need to look in more detail. Let's arrange the men in 2 blocks, each 10,000 men wide. The left group represents 10,000 unscreened men, and the right group represents 10,000 screened men. In the centre, we see that the groups branch due to events happening over 10 years related to abdominal aortic aneurysms. Looking first at the 10,000 men who accept screening, we see that 490 have an aneurysm detected. Over the next 10 years, 185 of these 490 have planned surgery to repair a large aneurysm. Of these, 179 survive the surgery. Unfortunately, 6 do die. A further 29 develop aneurysms that rupture over the next 10 years. 9 of them survive after emergency repair surgery, but unfortunately 20 do not. Moving on to those who do not have an aneurysm at the time of screening, we see that 5 men subsequently develop one which is diagnosed incidentally over the next 10 years, usually through an investigation for other reasons. These men survive planned surgery. 10 more who had no aneurysm at screening subsequently develop one which ruptures. 7 unfortunately die from the rupture, but 3 survive after emergency repair surgery. Now, let's see how the unscreened men do. 70 men have an aneurysm diagnosed incidentally, usually through an investigation for other reasons. These men all have planned surgery, and all but 3 survive. 107 men suffer a rupture of a previously undiagnosed aneurysm. 82 of these die, while 25 survive after emergency repair surgery. Let's look at the final outcome again, 10 years after initial screening. Among the 10,000 men who decided to be screened, there are 33 deaths due to abdominal aortic aneurysm. But among the 10,000 who declined screening, there are a total of 85 deaths. That's 52 more than in the screened group.